Hi, I'm Dr. Deanna Lights, the health reporter at WWJ Radio, and we're here today to talk to you about the coronavirus. Any questions, any concerns you might have. I have an expert with me to help answer everything that you want to know. I have Dr. Najiba Rahman from the medical director for the Detroit Health Department here to join us. Thanks for being here.
Thank you for having me, Dr. Lights.
And if you have questions that you want specifically answered that you don't hear here, please feel free to write in. We'll take your questions and you have a chance to speak with an expert here. So let's get started, first of all, with a little update. We have right now that we know of worldwide more than 90,000 cases, more than 3,000 deaths. Here in the U.S., over 100 cases in 15 states, not in Michigan, and 6 deaths. So I want to ask you, Doctor, it seems like just a few months ago, we were never heard of coronavirus, and now all of a sudden, that's all everyone's talking about. How does this happen so fast? We know in December in China, we first heard about it. Can you talk a little bit about how this can happen so fast and spread so quickly?
Yeah, so this is a novel coronavirus. So there are 7 coronaviruses that are in existence right now. 4 of them cause just the regular everyday cold. 3 of them have been linked to outbreaks. So this one that we're dealing with, COVID-19, has been associated with more easy spread just because it's a novel coronavirus. It means it's new, so it's never been seen in humans before. We haven't built immunity to it in the past.
And how is this transmitted?
So they believe it's due to respiratory spread. So if somebody coughs and droplets are released, or if they land on a surface, and then you pick it up by touching the surface and then touching your mouth or your eyes or your nose. That's what scientists are thinking is the mode right now.
And what are some of the symptoms that we might experience?
So like any respiratory illness, it would be fever, cough, shortness of breath.
And how is it that this is killing people? What happens to the body for some individuals that get infected with the coronavirus?
So we don't have all the demographic statistics on the cause of death for individuals, but many have died from pneumonia. Many of these individuals may have also had other comorbidities. That means other health problems that may have increased their chance of contracting the virus and then also not recovering from it. The CDC China reported that of their illnesses, most of them have occurred between individuals between 30 and 79 years. About 80% of those have had very, very mild symptoms. So out of 80 to 90,000 cases, there have been about 3,000 deaths. That case fatality rate is actually quite low in comparison to what we see with influenza. In the US right now, we've seen an estimated 18,000 to 46,000 influenza deaths. We've had 2 confirmed deaths from coronavirus this year in the US.
Okay, so yeah, people do forget about the flu,
yeah,
right? And we still are widespread in Michigan.
Yes.
So let me ask you then, what should a person be doing? That we hear so many different things, and what is your best advice for people to do at this moment?
So it's your everyday sanitation. Cover your cough or your sneeze. Try to use your elbow. Don't go to work if you're feeling ill. Wash your hands. So proper hand washing is with soap and water for 20 seconds. Make sure you're getting into every crevice on your hands. If you don't have soap, you can also use hand sanitizer. It should have at least 60% alcohol content.
Does that water have to be hot, cool, lukewarm? Does it matter?
It doesn't, but lukewarm is okay.
Okay, and then what about people are wearing masks, some people? What is your advice when it comes to that?
So the CDC is not recommending masks for individuals unless you're feeling symptoms of, fever, shortness of breath, cough. We also have to keep in mind that we have healthcare providers that are going to be on the front lines, and we're worried that we may run out of masks. So we really want to preserve those for individuals that need to use the masks. So if you're feeling symptoms, just stay home, take some days off of work. Don't send your children to school. That's the most preventive measure you can take right now.
Do we have any questions? Please feel free to write in. I think we do have one question, George.
Kelly Novak is asking, what is the percentage of deaths for coronavirus versus the flu?
Okay, what is the deaths of coronavirus versus the flu?
So we don't have the percentage for influenza. We do have an estimated 18,000 to 46,000 deaths from influenza in the U.S., and then we have 2 deaths from coronavirus in the U.S. The estimate worldwide for coronavirus deaths is about 2 to 3%.
Yeah, I think people do forget that the flu does kill and hospitalize a lot of people every year. We have another question.
George is asking, do children get coronavirus? I've heard they don't, or that they just carry it.
The question is, do children get coronavirus? George says he's heard that they just carry it.
So about 2% of those cases that were coming out of China were in children. There's a possibility that they're carriers so that they can transmit it to individuals, but based on the statistics right now, they're not showing symptoms or becoming as ill.
Okay. People are told to disinfect areas. Will household products that I buy in the store, wipes, Clorox, Lysol, would that work, or do I need something stronger?
Yeah, so just use anything that contains bleach as a disinfectant. Alternatively, we may start running out of a stock supply for that as well. So, your regular bleach solution at home, you can just put 1 tablespoon of bleach into a gallon of water and do your own disinfection, and it's probably a lot cheaper.
What are you telling businesses as far as, should they have employees stay home? Should they be doing a deep clean in their offices?
Yeah, so regular cleaning methods that they already have in place. And then we're working on sending out guidelines to employees as well, and to stay home if you're feeling ill.
Okay. We have another question, yes?
Christy's asking, and I guess they can hear me, so you don't have to repeat it. Christy's asking, are people overreacting when they do things like clear out the shelves at local grocery stores, or does it warrant this level of response?
So we don't have any cases in Michigan right now. We're hoping to keep it that way. I understand that people are worried. We are starting to see community-wide spread in the U.S., but again, we haven't seen any cases in Michigan, and we can reassure you that we are working very closely with the Center for Disease Control. We're working with the state health department, with surrounding health departments. We're on local calls all the time. I'm in communication with Windsor's health department as well to see what's coming from there. Anyone crossing the border is actually screened as well. And we're working with the Detroit Airport quarantine station too. So any information we're getting is up to date, and we want to make sure we're upstream of the outbreak so that we can inform you if there ends up being a case.
If I start to feel like I have symptoms, I know some of the symptoms could be similar to a cold or the flu. Do I go to my doctors? Do I walk to an urgent care? Or do I call from home so I don't maybe spread something to someone else? What's the advice?
So we would recommend calling your doctor to talk about your symptoms, if you've had a travel history. We want to prevent people from being in waiting rooms in case you are exposing other individuals. You may also call your local health department for guidance. We have a communicable disease team that can answer any question, and you can call based on your jurisdiction. So for the city of Detroit, it's us. Wayne County has their own, Oakland County, etc. Okay, we have another question.
Ruth is asking, what can you do to protect yourself on an airplane?
So on an airplane, the airstream, the way that the air circulates is actually, there are many air exchanges. And so, there's already precaution when it comes to tuberculosis exposure and all of that. So really, if you're sitting near someone that has a cough, try not to inhale what they're coughing, but I would recommend wearing a mask if you're around somebody that is, because that distance should be at least 6 feet.
Yeah, let me ask you, we're supposed to stay maybe 6 feet away from people. Should we stop shaking hands? Should we maybe limit our time out in crowds, like at a sporting event or a mall? What is the thought on that?
So we don't want to raise fear in individuals right now. Continue to live your life, wash your hands. Just don't expose other people if you're feeling ill.
Okay. And we have another question?
Yeah, VW is asking, what are some of the myths that you've heard about the coronavirus, COVID-19?
I'm not sure about any myths. Are there any that you have heard of?
Well, I hear people doing things like wearing a mask, and the masks you say, we don't need to be wearing unless we're sick or we're treating someone that's ill. That's, I think, one of them is I had seen that some people were selling products over on the web that could cure the coronavirus. I believe that that's all false, that there is no cure at this point.
Yeah, so there's no actual treatment for coronavirus. There are a number of medications that are out there that the FDA has not approved for treatment, and there's no vaccine either. So if you are reading about anything online, it's false information because it's not coming out of the CDC or the FDA.
Speaking of a vaccine, I know that all around the world researchers are working hard, but to get a safe and effective vaccine, it doesn't happen overnight. So would we see something? How soon would something like that be available?
So that is really unclear. We do have the National Institute of Allergy and Infectious Disease in Washington, D.C., and that would really be coming out of them for vaccine development.
But it takes time. I mean, we wouldn't see something in 30 days?
Yeah, I mean, even after the Ebola outbreak, they're still working on just the clinical trials component of the vaccine.
Okay. And if people do want information up to date, where should they go?
So we urge you to look at the CDC website. It is the most up-to-date information, as well as the State Health Department website. That is where you're going to be getting the most up-to-date numbers and guidance that's coming out of the CDC at the end of the day.
Okay. Well, thank you so much for joining us. And do you have any other pieces of advice you want to give our viewers?
Get your flu shot. We're still in flu season.
Oh, that's a good one. It's not too late.
Yeah, it's not too late.
And who should get a flu shot?
So anyone over 6 months of age should get the flu shot. And the flu season starts in October of the previous year, and it goes until May. But you can still get it from October until September 30th of the following year.
That reminds me, I did hear someone saying that, well, I got a flu shot and all my other vaccines are up to date. So that makes me stronger to be protected against the coronavirus. True or false?
It's false. So coronavirus is a totally different virus compared to influenza. So influenza will only protect against influenza A and B, and coronavirus, there is no vaccine.
Okay, but get it to protect you against the flu.
Yes.
Okay. Thank you so much for joining us. Thank you, Doctor. I appreciate you being here.
I appreciate it.